Patient rounding truly is that opportunity to connect with your patients. It's that opportunity to learn from them in real time what's working well, and also identifying in real time what might not be working well so we can provide that service recovery before our patients or their family members leave any of our healthcare institutions. I can go in all day, every day and check things off in an app, but if I don't connect with that personal touch, that human touch, then we're not going to reach success, right? And our patients aren't going to see that. They're not going to remember that experience of that leader coming in to round on them because it wasn't memorable. So it's really complementing our practice of doing exceptional leader rounding and now having a tool that helps drive accountability. It helps drive execution, and we can then start to really monitor how our patients are perceiving those interactions through our data. And up until now, we've just not had a good solution to do that. So I'm excited about this partnership with Laudio because it is helping us to complement what we know is already happening at the bedside. But now how can we optimize it and better measure to have continued and sustained success in this space? They're so excited to finally have a tool that is nimble, that is easy to access, that gives those unit leaders the information they need to run their unit instead of what we were doing before, which was a one-size-fits-all. And so you could be a mother-baby unit and you're still asking the same questions as a med-surg unit. Those patients aren't the same. And so what Laudio is affording us the opportunity is to customize our questionnaires to be able to fit the unique patients that we're caring for in our hospitals. So they're really running to the chance of turn it on for me now. We're ready to go. But those that have been through it, this first wave, have really just hit the ground running. And we're already seeing more compliance. We are seeing more notes being captured because the ADT feed allows us to see the patient name and other important information. So it's helping to really build that connection, whereas before we just had a patient room number. And so there was no individualized rounding happening at that moment. And that's why it felt like a check the box. And Laudio is helping us to transition to that connection and that memorable interaction we hope for our patients. From day one, the colleagues that we've interacted with, just the compassion, the kindness, the eagerness to help us move along, again, just to help us build the platform that we needed to support our patient rounding has just been phenomenal. And I can't say that about every vendor that we've partnered with. And like I said, I've been doing this for 20 years, so there's been a number of vendors and partners. And I think that's the difference in a vendor and a partner is that relationship. And so I'm just appreciative that Novant Health has had the opportunity to partner with Laudio for the solutions that we're engaging with you all in, because it's really made this easy. And who doesn't need an easy day this day in healthcare, right?